Great pleasure to actually have the Discriminatie.nl and Regio, so the Amsterdam region discrimination office, and colleagues here from Shinto Labs as well, and joining us online is Paul Perkins to actually walk us through work that they've been doing on actually building a system. So almost taking us from the paper discussion and the strategy behind that Mila was talking about into how does that actually work in reality or not? So over to you, Jerrol and team. Thank you.
Is this
Yeah, no, I think we need to take the hand mics, right?
Good morning, everybody. Welcome. Well, as you know, my name is Gerrol Marten. I'm the director of the Anti-Discrimination Bureau of Amsterdam in North Holland. I'm working there for now for 4 years. Before that, I worked 8 years. Well, I'm still in it in the anti-human trafficking. I used to be the director of the National Coordination Center. And we started there thinking about how can we get a better view on facts and figures on anti-human trafficking, on who are the victims, where are they? So we started together with my colleague Paul Foggins and Mary Adams. We had an advice office bureau, and we started thinking on how can we use modern technology to disrupt human trafficking. And so we came up with this idea of creating a dashboard where at that time we thought real-time data from different data sources to combine it to get a better view on. But then Corona broke out and everything lay down for a couple of years. And during Corona, I ended up getting a job at the Anti-Discrimination Bureau of Amsterdam. And for me to go to work there, I had to ask myself, what am I going to contribute in this sector? And I looked at where it stood at that moment in 2020, 2021. And to myself, I said, oh, this is like the anti-human trafficking sector, 2008. So we have quite a long way to go. What is missing in here? Well, almost the same thing. There are no actual good insights, figures on facts and figures on discrimination. Yes, we have the anti-discrimination bureaus who register. We have the police who register, and we have a lot of civil society who also do who help victims of discrimination and who register. But the way of registration is sometimes different. It's apples and pears. You cannot compare it. The anti-discrimination bureaus, the police, the OM, the Open Justice Office Department, and the College Rechten van de Mens. They have a report. It comes an annual report. It's called the multi-agency report. Comes out every year. But then again, these are figures that are at the end of the year. So whatever happens before, you have no overview. You cannot take any kind of measurements. As I said before, we are talking about different data that cannot be compared to each other. As anti-discrimination bureaus, we register, as was just said, the feeling of being discriminated against. So it's not hard facts. The police register hard facts because they do research, and if they think that it's valid, it will go to the court. So, well, we now are busy 2 years, I think. Almost.
I think so, yeah.
Yeah. So me and my colleague Belize, we were in the G4, the 4 largest cities. We have a steering group together, and we thought about, okay, what kind of problems do we encounter as the 4 major cities in the Netherlands? Instead of every time inventing the wheel again, let's put our thinking, etc. together. So it was, we don't have an integral approach on discrimination in 4 big cities. No, we don't even have it for the whole of the Netherlands. We don't have a good view on, well, as I said before, facts and figures. There is no there's not a good cooperation between all the different stakeholders in the field. And I was like, okay, I think we can reuse the idea that's still there on the plank. And we need to adjust it here and there a little bit. So I spoke to my colleague Paul and Mary, and we got in contact with Shinto Labs, and there the idea was born on how to do this. We had problems, and that is that dealing with the police said we don't share data with civil societies, and then we had prosecution who said the same. We had we are the four bureaus. We still have 14 others who said, "Oh, but it's our data. We're not going to share it with others." So it was a very difficult field. But we got the our four big municipalities to finance the project because they needed more insight on what is happening in their municipality, to take measures, to be proactive, but also to make policy. And so we started on this quest, and that's where we are now.
That?
Yeah.
There we go. Yeah. Okay. You're on fire, Jerrol. I've just been clicking through the slides a little bit while you were during the introduction slide. That's all good. Thank you. In one sentence, my name is Jerrol. I got a PhD in computing science, and basically my role was to talk to Jerrol and his colleagues and to translate that into a software tool, and a software tool that might be helpful, useful, easy to use, easy to understand. It's not that hard statistical as the previous presentation, but I also took that methodology with me, so I think there are some hooks that we can use to improve our idea. So thank you for that presentation. So the goal, basically what we came up with is, can we come up with a clear insight into all discrimination incidents and analyze and report on this in near real time. And I emphasize near real time because we don't really believe that the moment someone is feeling some sort of discrimination that you get a real time number in your report. But now it's like once a year in that big PDF report. We want to start with once per quarter, then maybe once per month, and increasingly get that more real-time insight that you get better analysis. So that's basically what we're trying to accomplish here. So how do we do that? Basically, from a technology perspective, we embrace the lean startup methodology, which is a way to work with the smallest learning cycle to just try something out and see if it works before you actually make a big project out of that. So just small steps, start learning, and based on that, start improving that, because we really want to get lots of people in the organization improve on using the tool. It's not about being the best or the most beautiful, but useful. Can it actually help? That's basically what we're looking for. So how did we do that? We started to identify stakeholders, and this is something called value proposition design. Basically, what are your pain points? What are the activities you want to support? And what are the benefits you want to get out of it, the green thing? So we are really starting to getting a better understanding how this might be beneficial. So once we identify the stakeholders, we're going to draw something called a map, which is basically a flow chart where we try to get data into something called the ADV data store, and then get data out of it, both from an analysis point of view, the partners, but maybe also the reporter. They should have a feeling that once they report something, that it will be used, that it actually makes sense and it's being useful to make that report. So this is basically an overview of the steps that we wanted to do. Now, then okay, if we have that data, what are we going to do with that? So we were identifying some functional capabilities like searching in the tool, searching through all the information. Also like a map, a geographical area, where are things happening, when are things happening, do some analysis, do some comparison. Because if something happens in a certain city or region, is that statistical relevant, or do you want to make some sort of comparison, contrast it with other areas? Performance dashboards, reporting, especially the reporting, the once per year PDF reports. From a technology point of view, we believe that we can make a little bit more interactive way of working with that, but that's us. So we try to improve there in small steps. I have a demonstration of the dashboard. I also have a video of that. I think we have time for video, right? Yeah, sure. So let's start with the video, and I see there's no sound.
Will you take us through it, or?
I will take you through it.
Okay.
I haven't seen the video yet. That's the only thing. It's a little bit of improv here. All right. Start at the beginning, and then you press the play button.
Yeah.
So when you start here with the tool, you can see that word cloud, and that's basically an overview of all the incidents that have been monitored. And we do give you an overview of what are the most relevant words out of that. We have all sorts of statistical data, which we can filter and give you insight and trends, both from the ADVs and the police. We're also going to add the new partners as well pretty soon. And you can really get an overview of what are the types of discrimination per year, and you can different visualizations. So it's just a way to get a better understanding what's in the data. It's because we found that the different organizations have different way of measuring. So we need to, in the next foreseeable future, start harmonizing that data so we get a better. Better? Oh, wow. It's different. Okay. With the data, you get better insight into what's happening over the different ADVs and their partners, and basically get that better insight. As you can see, it has we're still working on the look and feel, but the bread and butter are actually the data, the content of that. Per partner, we're going to create dashboards as well, both to get them on board and to get their information a relevant place. So here you can see the police, they have their own area in the dashboard. The police, this is one of the only moments I work with the police that they are actually willing to share the data, and they are really motivated all in to support that as well. And that really helps. Also, as I mentioned, there are a geographical way of looking into the data. So it's going a little bit fast. You know what? You get I think a broad idea of the tool. Let's switch to the slides. If you are interested, contact me afterwards, and I'll show you, give you a link to the video where you can see it at your own time. I think that makes more sense.
It works. That's what
it works. It does. So with the map view, you can see on a geographical area what's going on there. So you can use all sorts of filters within the tool, like the municipality, date, the discrimination ground, what type of discrimination. And in this case, I picked the city of Utrecht, and you can see the type of discrimination where race is being by far the furthest, the most hits there. You see some trend in there as well. And this helps you to differentiate where you want to focus on. So if you want to make a big dent into this area, it might make more sense to look into that, compare and contrast to like a political area. Again, you have vergelijken, which is the Dutch word for compare. So you can compare and contrast with different municipalities. So you can put them side by side and see what are my outliers and how does it compared to either in the region or maybe other cities you want to compare yourself with. We have all sorts of analysis to help you get a better understanding. On contrary to the previous presentation, we do have qualitative data in here as well. By design, we believe that the stories do help, they matter, they give you better insight also in a little bit of context. There are no personal information, so we removed everything tied to an individual, but the description based on the different things are in there as well. So that helps you not just the numbers, but also what is behind the numbers to get a more qualitative analysis on that. How does this help?
It helps. We report to our municipalities. That's the one layer. We are in a union of the different ADV's, the discrimination bureaus. They report to the minister, who is our opdrachtgever. So what we want is just not only to focus on registration of numbers, because in the Netherlands we've done research and only 3% of the population reports discrimination. So that's just the tip of the iceberg. So if we only have to look at the figures, then nothing would be done. We have a registration tool that we use within the discrimination office, and that's to help the people who report, people who experience discrimination or who see or hear discrimination. And there we report on the ground, the terrain, and the small description of what happened. So that's what's in the tool. And we can go deeper and we can put all those different summaries and have a good view on what is happening. And because we register on what we call the zip code, you can also in the map, we'll see it later on, you can see where what is happening. And that's also good to talk with the municipality, who is our opdrachtgever, on measures that needs to be taken or where we have to intervene or perhaps more on prevention. Also, you can compare, like in my region, I have 6 municipalities, so you have the same ground or same kinds of group, and you can compare the different groups with each other. Okay, if we look at anti-Black discrimination in Amsterdam, in Amstelveen, what are the figures? And then we go behind the figures, what are the stories? Oh, is there something we need to look out for? So we can gain more insight in the different patterns. And for the different municipalities, the different stakeholders, we can create also different reports by doing the different kind of analysis and looking at different figures, comparing it with other cities. So I can contact my colleagues and ask them, well, this is what we see. Should we take certain steps in trying to make changes?
So we are currently at phase one. Phase one, we are finishing this tool right now. We're going to full production with the 4 biggest municipalities in the Netherlands. We're going to add partners, police, as we speak. We're going to automate their data, which is very nice. The Public Prosecution Office, we're going to add that as well. And the Netherlands Institute for Human Rights will also join this. The next phase has been defined about scaling up nationwide. So we want to get that on a national level to get better insight and better statistics as well. The next phase would be linking incidents with all partners. It would be really interesting to see what type of incidents will actually be reported by the police, and what of them are being followed up by the prosecution, and what of them will be actually get a certain sentence, something like that. So you get a sort of chain analysis. What are the real, what is sentimental, and what is real, like wrong, and not from an ethical perspective, but from a legal perspective. So those are aspects we're going to look into in phase 3. And for phase 4, we're looking at possible integration with existing EU data program. And for that part, Paul Fokkens will join us online. Paul, are you there?
Absolutely. I hope you can hear me. And thanks, Jerrol, and thank Jurian for the introduction. Yeah, this is a Dutch initiative, and the Netherlands, as being a small country, part of the European Communion, we hope this will give some ideas to other countries. Now, if we go to the next slide, we know that in the European Union, for a large number of years, there is already projects and programs for discrimination. And I would like to mention to you the Eurobarometer survey series. I don't know if you ever looked at it, but it is very intriguing because you can see from a large number of countries data, hard data that is from interviews. And the latest data is from December 2023. So it's pretty much up to date, and you can look at it and you can download it. And the critical finding in this survey is the decision that there is widespread discrimination in EU member states. Now, if we know that and we know what is happening and where it's happening, we would like to see if that is in line with our findings in the Netherlands. So we believe that it should not be just left alone as another study. We would like to see if it is possible to get some form, and I'm just saying it very kindly, some form of integration of the data that comes out of the Eurobarometer survey series and the Zicht op Ondermijning, the Zicht op Discriminatie project in the Netherlands. Then there is another project that is run by the National Action Plan reporting tool called NEPAR. The person in charge is the EU coordinator, Mrs. Michaela Moa, and it is the development and the implementation and monitoring of national action plans against racism. Now, we believe the project that we're running at the moment in the Netherlands is one of these plans, NEPAR. So we would like to understand if we can find links or find a combination of NAPAR, which is required from the EU, and the tool Zicht op Discriminatie. So then the third thing is, and that is stated by the EU Commissioner Ursula von der Leyen, that we need to talk about racism. And yes, we need to talk about it. And we not just need to talk about it, then we need to act on it. And that's exactly what we're trying to do. So what we're trying to find value is in linking the data sets that are already existing in the EU and that we are discovering in the Netherlands. But of course, over time, we would like to find the same with other nations. I am sure that in almost every country in the EU, there is data available, but we need to find a way to link these data sets. Because if you link data sets, we can perform much more comprehensive analysis of discrimination patterns. It allows us to find trends and correlations that might not be visible within isolated data sets. And combining data from multiple sources enhances our understanding of how different forms of discrimination intersect and impact various groups. For instance, data from the Eurobarometer can be cross-referenced with the Dutch data to understand both regional and cultural differences in discrimination experiences. Linked data sets can inform more effective policy developments and implementation, and we can tailor interventions to address specific issues identified through this integrated approach, ensuring that policies are data-driven and targeted. Analyzing combined data sets can help in the efficient allocations of resources. We can prioritize areas with the highest need based on a holistic view of the data, ensuring that efforts are focused where they can make the most significant impact. And finally, linking data sets fosters collaboration between European and national bodies. This collaboration can lead to the sharing of best practices and the development of unified strategies to combat discrimination across Europe. Now, I would like to go to the next slide as an example what the Eurobarometer tells us about discrimination in everyday life in the Netherlands. So this is a direct copy of the data that is available on your country on a discrimination in everyday life. And when you look at it, you can come to some conclusions. Now, I'm not asking you to read all the data, but if we go to the next slide, then you can see the conclusion after analysis is that there is a striking 32 percentage point difference with 21% in the EU 27 states and 53% in the Netherlands. So the overall higher percentage across most discrimination categories in the Netherlands suggests a heightened awareness or concern about the various forms of hiring discrimination compared to the EU average. So that is quite an intriguing piece of information that we get out of the Eurobarometer. And then we can link that back into the monitor that we are developing in the Netherlands on discrimination. So if we go to the next slide, then we look at the required steps when we go the next couple of years. Of course, we need some funding to build a European template. And to arrive there, we need to discuss and with a number of people to sit down and how you can use the Zicht op Discriminatie and NEPAR for EU-wide use. So developing a European data space, which is exactly in line with the EU lines of business in the strategy for data, it gives us the ability to link data from different countries without sharing personal information, but doing analysis over the countries on discrimination. And that, I believe, is extremely important for the next couple of years. As Jurjen said already, this will not be a real-time view. It will be a near real-time view, but it is exactly what we are looking for to get some better integrated view on what's happening in Europe and not just what's happening in one country. So that is my 5 cents addition. Let's try to come with some integrated European view on discrimination based on what's already out there. Thank you.
Some more background information. Our Ministry of Internal Affairs and the Ministry of Justice are the ones who are going to finance the outroll of the national tool. As Paul said, by listening this morning to your story, I think within our view on discrimination, we can put some certain items that you mentioned from out of international. We can add that in our tool so that we can see if in the Netherlands we are reaching certain standards that are being set. I think we got quite a few good ideas on how to put some extras in our tool, so to see what our 2 cents that we add to the overall EU program in combating discrimination.
Wonderful. I'm going to amplify what Mila was just saying. Amazing. So really, really well done. Okay, and also well done on timing, because it means that we have some time for questions. So, oh, I see lots of hands, but you know what? I am going to firstly go to online because they always feel like they're behind us. So what's the question, Thomas?
So there's 2 questions from Alma Stefara from Human Rights Watch. The first one, I think for Paul, the question is really about whether this good practice, as you've just described, whether that is also being shared on the EU level. I mean, you've already spoken about it a little bit, but it's more a question about whether this is actually also happening now or not. And then the other question is, I think to all 3 of you, is whether the data that you use is also actually used actively to inform policy in the corporate and police departments, is the example that's given.
The information. Hello? Information is not shared yet on EU level. As we said, we are still in phase 1, so that means it's an experimental phase. As soon as we have the connection automatically with all our anti-discrimination bureaus and with the police, so I'm hoping somewhere in September. It's online now, but then it will be officially fully launched, and then phase 1 the project is up in the air, and we will try to give it as much audience as we can. Second, the data that's being shared already now in what we call the multi-agency report, the annual one, is being used for policy making by the government, by our internal affairs, by just the different 7 other departments that are that have discrimination within their portfolio, and also with the municipalities. So it's just not only for giving the figures, but it's also for using it in the benefit of.
That's what we want to hear. Okay, so there were lots of hands. Oh, yes. Thomas, did you see who was first?
No,
Okay. I see Darius giving me the eye. You've just arrived, you've not spoken. And then I'm going to go, I think, to... Oh my goodness. Yeah, okay, let's start with Darius, because I'm trying to get people who haven't spoken as yet. So, exactly, because... Darius, do you want to say who you are and your organization?
All right. Yes, my name is Darius Luis, and I work for ECONET, the European Network of Equality Bodies. Thank you very much for the presentations. Really interesting tool. I was wondering, I have a few questions. I also arrived 3 minutes late, so there might be the chance that you actually explained it before. But I was wondering, first is, so is this tool mainly to collect the data, or you also provide information back to the victim who reports about where to go or what to do? Also, is there a follow-up? And also, is this kind of a long-term commitment with the minister, or is it a kind of an ad hoc project? Could you also elaborate on that? Thank you.
Yes, well, the data that is provided is also for people who deliver data. It's also for them to use. There is behind the scene. Behind the scene, they have their own landing page in where they can upload data and use it for their own work. And we have to decide yet on which data we're going to put together on the dashboard, and what's going to be the use of it, and also for who's going to see it. And one of the ideas of the Ministry of Internal Affairs of the tool is that we have a track and tracing instrument for the victims, so that when they report to us or report to the police, or they go to the College of Human Rights, and their case is there, that they can follow and see where it is and what stage it is. So that would be the one of the outcomes. And your other question, this is something for stay. That's why it's being rolled out national-wide. So we started as a project for the 4 biggest cities, and the Ministry of Intelligence, this sounds good. We've been talking over and forth with the national coordinator, urging us to finish as soon as possible, because everyone wants to stop with the multi-agency report, which is a paper thing, and have this near real-time dashboard to use it for the different things.
Excellent. As I walk back to this side, please get it up onto the EU portal. So for the European Commission for best practices, so that it can be upscaled. Okay. I was coming to, and then I'm coming back.
Yeah, Tanya Gangarova from Germany. Just Thank you for the presentation. I was wondering, as we already have scientific evidence, even in Europe, which links police violence and racism, I mean, brutality as a police brutality, I wonder what could be the ethical implications of cooperation partner as a police in this case, if you can reflect on that, and can this data be used against communities? And I think more about collective harm and less about individual harm. Even if the data are not analyzed, we're living in a times of right wings. We know the situation. You know, that would be my question. More ethical question.
Yeah.
Thanks.
Well, those are the questions we need to address with each other. As I said, what we're trying to do now is showing what is possible. So this is data that is already shared publicly, but then in Excel sheets or in reports that are on internet. So one of the first steps is collecting all the different data that is already out there and is already public, and bringing it on one platform so that we can see what's there. Second step is a harmonization. Everyone registers on a different way, different grounds. Harmonize that. And it's also adding the different stakeholders. In the Netherlands, we have an organization that's called Control Alt Delete that really dives into police.
We monitor ethnic profiling and police brutality. So that's what we do at Control the Lead.
Yeah. So those would be some of the figures specifically from their organization that will be shown in the dashboard, and also their organization will be named. So at a certain point, we will need to put all the heads together and decide, okay, what are we going to do with this information? What are we going to, in analyzing, you have to use the right persons from these organizations also to give their feedback on what the figures means, and not just open. And then also, not everything is probably for all the public. So that's something we need to deliberate about.
So it ends up being in almost like a vault, like a health vault, but actually on race discrimination. I see nodding.
Okay, okay.
I'm
Okay, so 1, 2, 3, 4. Okay, right.
Okay, my question is very short and straightforward. The
And-
first one
and who
is,
are you?
oh, I'm Ashley Struggle, pharma industry, and from the Netherlands. One question, we've heard a lot about it, the impact of discrimination on health. You've mentioned you're going to link that to databases to identify potential follow-up from the police or potential follow-up within the justice. But what about the health impact? Is that something that you also plan to measure somehow? And the second point, and it was addressed a little bit in terms of when you mentioned the groups that are being the groups that are being victim of discrimination. Are you also going to look at the professions? Because you're mentioning the police, there is also a lot of discrimination within the police as well. My daughter is a social worker, she suffers also a lot of discrimination. So is that something that you will capture? Because then the organizations can work on it. Yeah.
Let me start with the last one. As I said before, we are still in an experimental phase. So in getting the biggest stakeholders together somewhere in the month of July, August, we're going to address the different rounds, etc. We need to look at what data is out there. Of course, we have the Ministry of Social Affairs and Arbeidsinspection. Those will be partners maybe for later on in the process. But we have to start. These are the ones that I mentioned. We are the big four who work very close together, and then we can later on we can start. We are taking it into account. Bernice might have something to add.
In addition, the tool is based on the discrimination framework in the Netherlands. So as such, we do not register only on the grounds of health. So if you go to the hospital and something happens there, either you're a policeman or a social worker, you can register the complaint. And then we sort of have to sift out the data of discrimination that is linked to the area of health. But this is not how the framework works in the Netherlands. There are 12 protected grounds, and there are a number of sectors, and that's it.
Okay. So this is where I beg permission. We have 1 minute to lunch. We have. Oh, okay. Great. Oh, 1 minute to the next session. So. Okay, so I have one person, but I still see 2 people. So very, very quickly, we'll take both your questions at the same time. So be prepared, and then we will close.
I will go very fast. I took notes. So to introduce myself, I'm Sabine Jones. I've worked in the National Scientific Center for Research on Statistics, Qualitative and Quantitative. And I have to say, we had a big analysis about police, the population of police, how they work, how they feel. So that could be very interesting, but I don't have the time. I am also on the initiative of the resolution of 2010 about violence to children. That was signed by many countries over the world, and I've developed now a project about neurodiversity. But I was wondering whether we could exchange some statistic methods and tools regarding children's rights with our topics here, because they can be really some methods that we could adapt. And also I'm dealing with trafficking, because you spoke about trafficking regarding children only. We had a very huge conference in Stockholm 2 weeks ago, and that's also some methods we could say. Just last about the last data you had about Netherlands. Is the first country. Just one question. What about France then? That's all. Thank you. Okay.
Hi, I'm Marlies from Germany. Okay, I feel like we've listened to more like the report about that, but we've not had guidelines on, because I feel like something contentious, as we understand, even the German government has said it itself, that we don't want to collect intersectional statistics based on the history of Germany. I'm thinking that maybe we should start with developing guidelines and a pan-European understanding of these are the formats which we follow. Is this something that you have considered? To contextualize what I mean is that the new federal police law in Germany actually states that it allows for racial profiling if the police officer deems it fit at that point in time. So I am struggling with that because there's a lot of like police perpetuated discrimination based on profiling and all these other aspects. So maybe first we need to agree on guidelines and what is even discrimination, because what I understand as discrimination is not what the government or the police understand as discrimination.
Okay. So.
Can hand that one over to my colleague.
Okay, keep it brief.
My name is Bernice Kalmes, and I'm director of the office in Utrecht, one of the G4 municipalities that launched the tool. In response to the Madame from France, I think the exchange would be very welcome on all grounds. On my website, we have a route for complaints about children, but unfortunately, it's only in Dutch. So I have it translated so that we can compare how you do it with how we do it. And on the second bunch of questions, it is true how we see discrimination at the bureaus is not the same as how the police would see it or how the public prosecutor would see it. But in Holland, we have something called polderen, and that means talking a lot, the talking shops that Jacqueline refers to. So every month or every 6 weeks, we exchange cases with the police and the prosecutor, and we try to get them to see the cases in the way we see them. It still remains a challenge. That's why we are traveling with civil society, so with Stephanie, and with Maricela, because only in collaboration with civil society will be able to make a difference, perhaps.
What about the guidelines?
We have built this based on the Dutch framework for discrimination. It's very, very technical, and it does not always contemplate the victim perspective. So we have to really, really, really reach the borders of our mandate in order to make a difference for the victims.
Okay. Thank you. I'm not going to take any more questions. So we have lunch in 45 minutes. Hold the thoughts that you had for all of the presentations so far this morning. But in the meantime, thank you so, so much for your patience, Runa. So, you've been great. So our final segment this morning is by Muna Aikins. She's going to tell us about Each One Teach One, Afrozensus. And I'm just so delighted to see you from Max Planck Institute. It's an absolute privilege. So over to you, Muna.
I think so. I don't know if this one works. Oh, because yeah, it works. So a little bit closer.
Right.
And it will be easier for me.
Yes.
Yes, hello everybody. I'm Muna Aikins and I'm from Berlin. I'm a social scientist who currently works at the Max Planck Institute for Human Development. There I pursue a PhD in developmental psychology, researching on biosocial pathways of racialized inequities on children's and adolescents' mental health. But today I'm here with my other affiliation, which is the Afrozensus, Each One Teach One. I will most of the time say shortly EOTO. So Each One Teach One, I have been working there the last 8 years as in different roles, but mainly today I'll talk about from the perspective as a researcher. My colleague Angelo is also here, who will be on the podium in the afternoon, and you will get more insight into the work we do. So Each One Teach One, EOTO, is a communities-based program or communities-based organization. It's a civil society organization focusing on education, empowerment, and community building in general. This is actually the place. What you see on the picture, it's illustrated by a fabulous artist for the Afrozensus report, which I'm presenting. And EOTO has many branches. One of them is the library, as you can see on the picture. It is the largest library with Black literature in Germany. It was collected and built by Black women mainly. And we do have many different projects. One core project is also the youth project, where we do a lot of social work with youth. And also the COMPET. The COMPET is like the competence network for anti-Black discrimination or anti-Black racism. And it is together with the Initiative for Black People in Germany, which is one of the largest civil society organizations in Germany. So yeah, we do a mix of art, literature, youth work, etc. And we also have, which is very important, it's called Each One, the anti-discrimination counseling, which also does monitoring. So people can come and talk about experiences they made in different areas. So this is the team, the core team of the Afrozensus research project. We have been doing this during COVID, as you can see. So it was in 2020 and 21. We published the report end of 21. Yes, Kwesi, Teresa, and Daniel. And So during my talk, I want you to remember that it's based in people of African descent context, and that it's very important that Blackness is a cipher. So we're having these conversations intergenerationally, internationally, and interdependent. So as Ocean said yesterday already, or was performing with his art, that we stand on the shoulders of giants, we stand on the shoulders of the ones before us, and so on. So yeah, I really like this quote by Mina Salami. And the Afrozensus is based within this Black knowledge and Black movement, and is a part of the Black movement. So it's not like that the Afrozensus does invent new things and so on, but more like goes into this line of Black research and movement. So let me say a few words about the German context before I go into the study. It's very important to review the history, the European colonialism and German colonialism and Nazi time when we talk about racism. So here we need to talk, and it was mentioned a few times, scientific racism, racial essentialism, and the two genocides committed by the Germans. So the first genocide, killing thousands of Herero Nama in today's Namibia, but also the Holocaust, killing millions of people, the systemic murder of millions of people. So it's very difficult to have a conversation in a German context about race and racism. So you already heard also a few times that we can't even find a word to say race. So the term Rasse is very conflicted, and it connotates a lot of biological understanding of this racial purity and so on. But this comes also quite handy historically, that people are like, oh, let's not talk about race. Let's not talk about this issue. It's an issue of the past. So it's always like, or a lot of times displaced in this race evasive manner where they like, most people say it's in the past. So we work on that because of the Holocaust and so on. Or they say it's like the socially marginalized groups, or it's a right-wing problem, etc. Or it is like geographically dismissed by saying it's like the French or the British people were worse than the German colonialism. So it's a US problem and it's a British problem, but in Germany it's not that big of a problem. So a lot of scholars try to study racism by using migration background, which is a very bad concept, as we learned the last 30 years. A lot of scholars have been fighting for, and also civil society organizations, to not use that as a concept. And there also, as Marlies was saying yesterday already, it captures also white people or white migrants. So it doesn't make sense to use it as a concept to measure race or racialization processes. And also we talk a lot about foreigners in Germany, but people who have been living there for centuries, their families living there for centuries, are not foreigner to this country. And we use also a lot of terms of culture, saying like, okay, because Turkish people or Arab have this and that culture. So we moved from this avoiding Rasse to going into different notions of like translated the whole race understanding into culture, migration. And it aligns with the whole idea of raceless Europe, like where because of migration, race comes into the whole thing, and not because of the history and the structure built by European colonialism, etc. There's a great scholar, Fatima Altay, who works a lot on this. So unfortunately, having race-based approaches, which means deliberately avoiding racism, to talk about race and racism, it did not help to dismantle racism. So 49% of the German population still believes in the existence of human races. And these biologistic constructions and cultural hierarchies. This is by the new National Monitor for Racism and Discrimination, by the DITSIM, which is like the German Center for Integration Migration Research, I think, where my colleague Tanya also works. So a significant portion of the German population still has this idea of race. So it's very important that we know race is not real. We talked about this also last day, but it's real in its consequences. So it does cause harm, and it does systematically marginalize people. So because we had this discussion yesterday also on how to talk about groups who are affected by racism, it's very important that we consider which concepts we use, and some seem very complicated. For example, in a US setting, a lot of scholars and civil society activists started talking about people racialized as Black, or racialized as Hispanics, or people racialized, people racially marginalized. Because we need to always center also the ones who are not marked. Like white people are not mentioned if we talk about racialized groups, because all we think of is the ones who are affected negatively by racism and the ones who are profiting from it. So it's very important which language we use when we try to describe or come up with new concepts, how to measure racism. So let's go into the study now. The Afrozensus, as I said, is from 2020. It was funded by the Anti-Discrimination Federal Office of Germany. It's a large-scale study which focuses on the empowerment and validation of Black people, Black African, Afro-diasporic people, we said, because these are very different groups who identify differently. So Black is a diverse group, that's very important, but I'll come to that again. So it's a communities-led research project, which is driven by the community. It's done by community scholars with community organizations in the civil society context. So it's driven by communities activism, social movements, and scholar activism. And it is very important that we wanted to, because the German context is so heated, we wanted to do a project which also kind of gives a safer space and have this no harm policy when we approach marginalized communities. And it's very important to secure also the data ownership and monitoring by these communities. So the Afrozensus has two main approaches. The methodological one is numbers do not explain mechanisms. So it's a mixed method study where we use quantitative, it's an online questionnaire, quantitative survey, and qualitative research. So because we did not have enough funding, we could just do this in two main domains. So we asked the communities which are the most important ones to them, and via these communities consultations, it became education and health. So the mixed method analysis are based on these two domains, but we have also many open-ended questions in the survey. So, and the theoretical approach is a racism critical one based on Black African feminist and decolonial approaches. It's important. So the survey, we run the survey from July to September 2020, and these communities are considered hard to reach and hidden, but the question is like, for whom hard to reach and for whom hidden. So with this project, we could prove that it's possible. We used the snowballing sampling and snowball sampling by self-identification and self-positioning of the people participating, in cooperation and outreach with 15 communities organization, which work also broad in the German context, and well-known Black individuals, as well as other organizations. And things were really heated in 2020, as you all know, also during the Black Lives Matter movement. So we had little funding to just design this project and to get it started. And then there was COVID, so everything was already very difficult. We couldn't reach certain places, we couldn't reach asylum homes, etc. So we couldn't go places and ask people to be part of this, because the work of going engaging with your own communities about data collection is also a very challenging one, especially in a German context, because you have to explain a lot how safe are the data, who's gonna review the data, where is it stored, etc. And COVID was not really helpful, but the Black Lives Matter movement was. So we were expecting like maybe 2,000, if it goes well, 3,000 people to sign up. So 10,000 signed up. So it was really amazing. And then around 6,400 participated, and after data cleaning, we around 5,800 participants in this study. When you were saying, for example, you need Mila, you were saying you need a larger sample, and the FRA report has like almost the same sample for 12 countries. Yeah. So it's also what I want to emphasize, it's a community's effort, it's a collective effort that also so many people signed up and trusted this project. So, and we have 4 principles for the collection of data. As I mentioned already, the self-identification, of course, you have to voluntarily participate, etc. I won't mention all of them, but I want to repeat the principle of non-harm, that it's very important that you make sure the data is not misused. As I already said, Black communities are diverse, and they make different experiences, and at the same time have shared experiences because of racism. And anti-Black racism is a specific form of racism. These are 2 premises we used for this study. And we had to do an intersectional approach. We had, I don't know how many dimensions of diversity it was, but all of them you can see listed here. Here also we tried to include as much as possible, and then the questionnaire was just getting longer and longer and longer, and it took so much time to do. The average time, I think, was like 40 minutes to conclude this questionnaire. So we really tried hard to do it as intersectional as possible. So to the results, here you can see we asked people about 14 live areas, and their experience. First, we asked if they had contact with the police or the healthcare system, etc. And if they had contact the last 2 years, they had contact, did they experience discrimination? And if they experience discrimination, what do they recall or think was the reason for this discrimination? That's how the questionnaire is structured. And as you see, most areas, they report discrimination. In the disappointment, yeah, no, this won't be able. But the healthcare, you see the healthcare. If you sum up the sometimes, often, and very often responses, you get around 64% reporting discrimination, experiencing of discrimination in the healthcare system. And yeah, you can check. The good thing is we're translating this report right now into English, so it will be available in I think the next 2 weeks. Then you can also read all these different aspects, because you have each chapter, like each live area, we have a chapter written. So the report is 300 pages long, so it's really hard to summarize this in a presentation. Yeah, so in total, 97% report that they experience anti-Black racism when we asked these in the survey. And when we use the mixed method analysis, we can see these are the patterns of anti-Black racism, which is like the process of othering in general, hypersexualization, criminalization, especially in the healthcare system, like the non-recognition of qualifications. And for example, we had interviews and focus groups with medical doctors and people working in care, and they were saying like they also the surgeons they're like people think they come to clean the room while they're the doctor. So it's really people are questioned the whole time why they're there, what they do there, and people just assume that's because they're the cleaning person. So Black people experience that they're being de-individualized and homogenized at the same time. So there are these stereotypes where people are being like, oh, you can dance well, you can do this well, or that not, and so on. And a common pattern is also the denial of anti-Black racism. So people are saying like, oh, that's not what the person meant, or that's not how it was. Specifically for the healthcare system, we observed a dual exclusion mechanism, which means like you either use or go to a healthcare system and then experience discrimination, or you don't because you're already afraid of being discriminated against and experiencing racism. So, and it gets worse intersectionally when there are other structural deficits, etc. So, yeah. So because we asked people if they experience discrimination in the healthcare system, what they think, what the characteristics were. And here you can see that almost 75% say it was skin color or racist reasons and the name. And then we go into the intersectional dynamic of gender and race, especially Black women reporting it. You can see this here, where when you go to gender identity, you see that compared to cisgender men, that cis women and trans, inter, non-binary people report higher discrimination, experience or more often discrimination. And here you see some of the diversity dimensions. So to summarize means like that discrimination and racism, structural racism especially, is embedded in the healthcare system everywhere. Like when it comes to training, qualification, as well as diagnostics, as well as research, as well as the supply structures in general. This is a illustration from the focus group discussions with medical, like Black medical professionals. We asked also very common things about what people, what we could gather before while we were designing the questionnaire, and people report, for example, to 66% that doctors, they don't take my complaints seriously, and people are afraid they can't report their medical conditions and won't get the support they need. This also happens in the psychotherapy context as well, where the experience of anti-Black racism or racism in general is being denied. And almost 100% of the responses assume that discrimination happens in the healthcare system, besides their own experience. If they even not had a racist incident there, they know, or they assume that it's happening there, and 14.7% avoid to go to the supply structures. So this leads to consequences like discontinuing or delaying treatment, especially in psychotherapy and psychiatry contexts, avoiding the use of healthcare, and being in mental stress, and having a lot of burdens also, especially for Black healthcare professionals. and additional costs. Like people ask usually at EO2, do you have lists of doctors where I can go and I won't be treated this way and that way? So they have always additional costs. So you ask the people you know if they have experience with this doctor and that doctor and so on. From the perspective of healthcare professionals, we asked them also about how they deal with that, how they cope with that, and they reported, for example, that they do most of the empowerment work themselves. So there are no structures that support them, because in medicine, in the healthcare, it's also very hierarchical, etc. So they were saying that they mentor themselves or each other. They do networking with other Black professionals in Germany. There's also this new organization or founded also in 2020, around 2020, Black in Medicine, where they try to give each other guidance. And they also describe what is very important, that Black professional expertise, that you have to deal with racism, makes you somehow, you need to become an expert on this topic, and then also you do the same time. It's important for your empowerment, but it's also important for anti-racism work. So people also, for example, some colleagues think, white colleagues think, oh, I need your opinion on that. Was this racism or that racism? So the Black person is being asked, or the Black person has to name the whole thing and so on. So it's really hard to navigate this doing extra work, where I was also talking about additional costs at your workplace. So I want to summarize recommendations. So I said this report is very long, so there are many, many recommendations, regarding education, health, etc. But for health, I have noted some here. One important one is, for example, the evaluation of treatment concepts and training programs we have. Also to educate like younger generations. And we did not just write recommendations for politics and administration, but we also wrote recommendations for our own communities, for the Black African Afro-diasporic communities, where we were like, we need to share more knowledge. We need to have alternative structures where we can share or train people how to say what they need when they go to the doctor, etc. There are a lot of structures, especially in refugees context or criminalized, illegalized people, but we need to do better in this. And also we need to make more use of complaint mechanisms so that it is statistically registered. Like people need to report what happened, even if I know it's additionally like a cost also to report what the experience was. So to summarize, we need to study racial disparities in the German context. I told you in the beginning, there are race-evasive approaches to avoid racism and race-related things. So, and the history of medical research or health is very much based in violence and colonial history, etc. And these events also make like marginalized communities mistrust the system, mistrust the structure. So we need to take this very serious, and that's what we tried with this project, to take it very serious and to consider this impact it had on marginalized communities. And yeah, unfortunately, German science and German society lacks differentiated concepts and data. We need to work on that to examine race and especially the process of racialization, because we touched also on this. It's perception and it's like feelings, and I tried to put it mostly in experience. People have experiences, and these experiences have different sources, but it's really important that we focus on the process of racialization, how it happens, how people are being assigned to racial categories, and how it affects them. And I want to close with two quotes from the Afrozensus where respondents share with us. One is a Black empowerment, enlightenment, networking, education, and new terminologies. We need this because they can give a name to what is experienced and thus make it real and also tangible for others. and also for like also other race, like racism, because I talked about anti-Black racism, but it's also relevant for anti-Muslim racism, etc. And also to emphasize all this knowledge was already there before. We just quantified it in a survey, in a study, and it's very important to consider indeed there is knowledge, indeed there is experience. This knowledge, however, is not being recognized to matter. Thank you very much.
Thank you so, so much, Luna. Yeah, that was personally edifying. And I think for many people in the room, we recognize from both our personal as well as professional lives, a lot of the research respondents responding points which were being made. One question, if I may, which actually came up online already was, funnily enough, because, you know, as we were listening, I was thinking, I really wish I had a list of doctors and medical professionals with of African descent that I could actually speak to. Yeah, so this is for you and any of the audience. Does an association for Black healthcare practitioners exist? Oh, I see some heads nodding. I see a couple of heads nodding. So while they answer that, can you all come up with your other questions and comments for Muna? Great. This is like a crowdsourcing. I'm so happy.
Hi, I'm from Germany and I work in medicine, but also in I'm hardcore in grassroots. So this is not usually my kind of environment. I'm also a queer person, so intersectionality is an important thing in creating this sort of statistics. So IOTO is the go-to for racialized Black folks who are like, I want to get a doctor. There's lots of lists that have been developed in Germany. There's one that has been formed by a white organization that took the initiative to say we are allies and we want to work with, to support queer folks. And if you go on their website, maybe if they search, they can be able to see how it works. It says the type of doctor you need, so a cardiologist, which city it is, and where you're from. But on top of that, it's a lot of hard work because it means going to the doctor and being like, we want to put you in our list. Do you agree with treating trans folks? Are you open to these types of things? So there's that. And there's Black in medicine, which has been mentioned, that is formed by other Black folks in medical. But most importantly, we've worked on our list in our own organization that it's intersectional to say we not only are looking for Black doctors, but we're looking for Black doctors as well, because there's transphobia in the community, that Black doctors that are okay with working with trans folks. So we have this list. We don't share it online because of GDPR. So usually we are like, we rotate it like it's hush hush under the table, or you call and we are like, here is, you didn't hear it from me, but if I was to give you an idea, you can go to these doctors. Because some doctors have weaponized it to say, oh, so you're labeling me as a racist because I refuse to be on your list. And the worst thing you can do to a German is call them a racist. If they're racist, so yeah.
Okay, excellent. So I'm now coming to my Belgian colleague. I'm just desperate for this list while that's what I said.
I'm Walter, medical doctor from Belgium, working on race and health. It's the same in Belgium. The lists exist, especially also of mental health workers of color, but they do not exist officially. They're going around in WhatsApp groups among the Black community. It's indeed GDPR wise and other reasons that it's not put on the website, but they do kind of exist, yes. I had one question or an advice maybe. Did you publish this study in a scientific journal as well? Because
no, we're having a whole discussion on that because it is done by community scholars and with scholar activism in the mainstream German academic setting is not considered as scientific enough. which doesn't make any sense, but it's like also who defines what is scientific and not.
Exactly.
So, no, because for us it was very important to publish it for the communities, not to publish it in a scientific community setting. So what we also did, what I forgot to mention is, what we do a lot is also the translation into English is very, because you could do the questionnaire in French, in English, in German, and we wanted also to provide it in the languages people also participated in, which is sad because we could just do like this colonial languages, but because it's always a matter of resources. If you don't have the resources, you can't do, you try to do what you can do. And we also try to do the science communication, or to communicate and facilitate this report to our own communities. So we did, for example, it's a very long report. So the last 2 years we have been, for example, working on fact sheets to make it very precise, also for educators to use it in their work, for like teachers to use it in their work, etc. So no, we did not publish it in an academic setting, but that wasn't also the goal.
It might be just another way of communicating. We just published this month in British Medical Journal a study on racism in Dutch healthcare in the Netherlands, work by Sharifa Zimouri and Amakisi. So also the scientific community gets communicated to words in their own language or something.
Yeah.
And another thing is Race and Health is a group at the UCL in London of activists, artists, scientists, people from the community. It's worth maybe to link up with similar groups in different countries in Europe to unify and to be stronger.
Wonderful, thank you. And I will be in touch with you while Jeff is in this. Okay, let's be real. I see Modi saying the same thing. Okay, other questions, comments, before, yeah?
Comment, yes. In the Netherlands, as you said, we are starting with mental health, especially the psychologists and psychiatrists. They are starting to form a list of Black helpers, and it's they're doing it from within their own society. It's available for us. We put out the question, and they started to form it, and they are organizing. As to the report, as you said, it doesn't need to be in the academic world. I think as a social how do you call it, intervention, as what you do. I think it's very important to have these kinds of reports.
But it's quite academic. It's just not peer reviewed. So it's like it's not like it's not there. The whole report is available. You can download it as a PDF. You can also download all the illustrations and graphs and so on. So we really try to make it accessible.
Sure.
It's about academia. Academia accepts it as part of the knowledge production, and that's also we have to consider how this is set up and so on.
Sorry, I see, so whoever had their hand up needs to wave, because I didn't see you. Oh my goodness. Okay. Okay, I'm going to give. Yeah, Modi, I'm going to give you the last, because we're literally, I'm being told to wind up for lunch because we have 2 interactive sessions where we'll talk about the data question in general, and also the conference, this meeting in general as well. So Modi, you get the final word before that.
Thank you so much. One question, first, thank you for this morning session, very insightful and inspiring. Call on to exchange and collaboration, and this especially when it comes to community-based research that are really important, and how it's also key critical to have recommendation on how these can be funded more. Otherwise, they stay into, like for us in Belgium, as a pilot mode. Because when you don't have resource, it's more difficult to engage with the communities because you have to engage them with them when they're available. And this requires sometimes finances to be able to do so. And really, somebody spoke yesterday about community-based research, but I didn't have the time to wave and connect. I'd be really willing to exchange with them. And also availability of researchers and their research means how do we interlink all those networks? Because it's not because you don't see it that it doesn't exist. Somebody said that yesterday. In Belgium, there's various ways of accessing the medical professionals, and it's not because they're shadowing themselves. It's because they're available where they are needed, and they don't know forcefully where the interlink is. You have also an initiative in the media communication. There's a magazine that gives everything that is available as a professional of African descent in Belgium. It's called Vitrine Africaine, and there's a section for anything that goes for medical section. Of course, it's a commercial. You can advertise yourself. It's on a voluntary base, so there's no issue about being seen in public or not. Whereas I understand my sister from the career and the importance of intersectionality. This is a question that we have to address in safe spaces in our communities. To make that available for the research, whether it's a professional or community-based research and publication availability in all languages. Because as my sister said, we are the subject of what we are searching to correct and giving solution. And this can give us some kind of schizophrenia. It's a long, great mental charge on us. So we always navigate into those areas where you're the researchers that can be triggered by the problem, and you have to find a solution.
Great. Thank you so much, Rodi. Come to me over lunch to how I tell you, so I can tell you how we got around it with the foundation for PhD researchers and university partnerships for free. Okay. So with that, I'd like to say thank you to Muna, who's retaken her seat, to all of the interventions and workshops for this morning. I see that we have already started putting up extra post-its onto the blogs. This afternoon is to round up on health data with an interactive session, and then also round up on all of the points that we want to see move forwards in the final session of today. So you guys will be thinking, acting, moving, certainly with your little grey cells, as we Belgians like to say, with Poirot, and really thinking through what do we need to go into the recommendations, moving through to the next iteration of the EU anti-discrimination strategy based on our discussions and also your own experiences and activities and agendas in your home institution. So lunch, yeah, for 1 hour, we are back. Understand there will be a bell. So, and again, reminder for bio breaks, the corridor on the left, first male toilet, second female toilets. I think there's a disabled gender neutral toilet somewhere as well. Yeah, in the same, but on the left hand side,
corridor. So bon appetit, smakelijk. I don't quite know how to say that in any other language. And we'll see you back here ready to start. So slightly before, but ready to start at 2 p.m. Thank you.